A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a dramatic turn of events, 12 Democratic members of the Senate Finance Committee, alongside independent Senator Bernie Sanders from Vermont, have called for the resignation of Health and Human Services Secretary Robert F. Kennedy Jr. This demand came just moments before Kennedy was set to testify before the committee, highlighting the rising tensions surrounding his controversial policies and actions since taking office. The call for resignation was made public in a statement that notably excluded Senator Sheldon Whitehouse from Rhode Island, indicating a possible divide within the party on this issue. The backdrop to this political turmoil is Kennedy's recent handling of vaccine policies, particularly in the wake of the COVID-19 pandemic. During a heated Senate hearing, Kennedy faced relentless questioning from both Democratic and Republican senators regarding his approach to vaccines and public health. Senator Bill Cassidy from Louisiana, a physician and key supporter of Kennedy's confirmation, expressed concern that some of Kennedy's views on vaccines were jeopardizing public safety and undermining medical progress. Kennedy's tenure has been marked by significant upheaval at the Centers for Disease Control and Prevention (CDC), where he recently fired Director Susan Menarez, a move that has sparked outrage among health professionals. Menarez, who had previously been endorsed by Kennedy, accused him of deliberately weakening the public health system and vaccine protections in a scathing op-ed published in the Wall Street Journal. In his defense, Kennedy claimed that Menarez's dismissal was necessary and justified, stating that he had questioned her trustworthiness directly. "I asked her, 'Are you a trustworthy person?' And she said, 'No,'" Kennedy recounted during the hearing, a remark that drew sharp criticism from several senators. The Senate Finance Committee hearing was characterized by sharp exchanges and escalating tensions, as Kennedy faced accusations of lying in previous testimony about his intentions to limit vaccine access. Ron Wyden, the committee's top Democrat, asserted that it was in the country's best interest for Kennedy to step down, urging President Trump to intervene if Kennedy refused to resign voluntarily. However, Republican Committee Chairman Mike Crapo defended Kennedy's focus on chronic diseases, indicating a split in the party's stance on his leadership. As the hearing progressed, Kennedy found himself on the defensive, particularly regarding his controversial stance on mRNA vaccines. Senator Maria Cantwell labeled him a charlatan for his attacks on mRNA research, while Kennedy retorted that Senator Maggie Hassan was engaging in crazy talk when she highlighted the difficulties parents faced in accessing COVID vaccines for their children. The political fallout from Kennedy's actions has been swift and severe. An open letter signed by over 1,000 current and former Health and Human Services employees called for Kennedy's resignation, citing concerns that his leadership was endangering the nation's health. The letter pointed to the recent upheaval at the CDC, the Food and Drug Administration's decision to rescind emergency approvals for COVID vaccines for young children, and the appointment of individuals deemed political ideologues to key positions within the vaccine approval process. The letter, released by a group named Save HHS, emphasized the signatories' commitment to their oath to support and defend the Constitution and serve the American people. It stated, "Our oath requires us to speak out when the Constitution is violated and the American people are put at risk." Kennedy's controversial past as a prominent anti-vaccine activist has come back to haunt him during his tenure as HHS secretary. Once a respected environmental lawyer, Kennedy has spent decades promoting misinformation about vaccines, a stance that has increasingly alienated him from both public health officials and lawmakers. Since taking office, he has restricted COVID-19 vaccine access to narrower groups, cut federal research grants for mRNA technology, and redirected funding toward debunked claims surrounding vaccines. As the political landscape grows increasingly hostile, Kennedy's future as HHS secretary hangs in the balance. With calls for his resignation growing louder and bipartisan criticism mounting, the question remains whether he will be able to navigate this tumultuous period and retain his position, or if President Trump will ultimately decide to replace him in the face of mounting pressure from both sides of the aisle. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.